Hi, I'm Perry Atkinson, General Manager here at theDove. Hey, check out our other videos and check out our website at theDove.us. Welcome to Focus Today. I'm your host, Perry Atkinson, and nice to have in the studio with us today Dr. Joel Klein. He's with Ventana Wellness, and we'll be taking your questions. By the way, you're welcome to call in anytime. We're talking about a big subject today. Maybe you have some questions about it. The phone number is 541-776-5368 or toll free 800-373-5368. And by the way, maybe there's some topics in the future you'd like to have Dr. Klein tackle, like whatever.
Whatever. There's so much out there, and
anything they want to. So if you've got a subject that's you want him to talk about in the future, I'll tell you what you do. Email us, theDove at theDove.us, and then we'll talk to Dr. Klein and we'll get him in to talk about those various topics. So maybe there's something you're very concerned about, from chronic pain to diabetes to cancer, whatever. Just email us a topic that you'd like him to maybe tackle in the future. And just email us, theDove at theDove.us. But today, we want to talk about diabetes, which is a big thing. But before we do, today is National Chocolate Day, Dr. Klein.
Couldn't have asked for any better synergy or synchronicity, as Carl Jung would have called it.
Okay, so the difference between milk chocolate and dark chocolate.
Milk chocolate's mostly, I'm looking at the ingredients here. Number one ingredient, milk chocolate. The first ingredient is sugar. Okay. So that's part of the issue. Yeah. Whereas other chocolates, and you can see now that, especially they're selling ones now that are much more higher in the cocoa content, just the actual cocoa, 70%, 80% you'll find these things. And that's where all of these things, and of course, I haven't checked on this, but I would wager that these studies that have come out about, all the benefits of chocolate may be financed by the chocolate people, but nevertheless, there are these good antioxidants. When the more natural it is, there's going to be antioxidants in there, but there's also what are called methylxanthines, which are caffeine-like derivatives. Oh. So that's why people can get some stimulation, have to look at it from there. But there are some benefits, and I don't want to tell people absolutely not, but if you want to do, especially if we're talking about diabetes, we need to cut back. Eliminate is what I'm going to say today, the sugar.
Okay. All right, let's get into this. If you have any questions for Dr. Klein about diabetes, 541-776-5368, or if you're outside the immediate area listening or watching, feel free to give us a call, toll free, 800-373-5368. All right, diabetes, huge. I don't almost call it somewhat epidemic, but what is it? What is diabetes?
Epidemic, I think, is the absolute word. Okay. So diabetes is a shorthand. And again, most of these medical diagnoses, so the word diabetes just means flowing through. Okay. That's all that word means. Because people with very high blood sugars, the sugar's spilling into their kidneys and their urine, and one of the hallmarks of people with uncontrolled diabetes is they're urinating all the time because they're passing out all this sugar, and then that's where the name comes from. It's been defined, and it's an artificial definition by blood sugar. Okay. Whereas a fasting blood sugar of greater than 125 consistently, or after eating blood sugar, and I actually forget the number, maybe greater than 160, is what's been the diagnosis based on blood sugar. But if you really look at the disease of what is diabetes, and we're talking about type 2 diabetes at this point because that's the biggest problem, it is actually, the blood sugar is a side effect, you could say, of the actual cause, what's the underlying the disease, and that is a disease of insulin resistance. And people have heard that term, and our bodies actually become resistant to insulin over time. Somewhat in the same way, if your body is bombarded with stimuli, I mean, these are different mechanisms, but let's say you're in a room with very loud noise or high volume machinery for a long time, and you walk out, you can't hear because your body's adjusted to that high level of noise, and it takes it a while to come back. Same thing with diabetes. You've actually become resistant to the action of insulin. And that is the underlying cause. So actually, when you look at type 2 diabetics, the insulin levels in their body are high because the body keeps trying to force more on top of that, and they're resistant. And is that insulin resistance that causes innumerable biochemical and physiologic effects that we then associate with diabetes. In addition, even more so than just what the high sugar does.
So, is this insulin issue directly tied to sugar?
Yes.
Okay.
Over time, the stimulus that we're reacting to is being bombarded with foods that are very easily turned into sugar. Obviously sugar, but then we're obviously talking about the processed carbohydrates without the fiber in them. There's bread, pasta, crackers, chips, cookies, cereal, tortillas, all these things that we're eating that constantly bombard our body and that overstimulate the production of insulin. And over years, again, that overstimulation, that excess stimulation to the body develops somewhat of a resistance as a protection to that.
All right, let me skip forward and then we'll come back. Can you be cured?
I think you can. Now, some people would say that, well, no, once you have it. But no, I think this is a completely, I use cure as kind of a come-on phrase. I think it can it
Okay.
is really the thing. And so that, yeah, actually
Primarily
you don't have it.
nutrition and diet, right?
Diet, exercise are going to be the predominant roles here, with certain amount of supplementation, depending on the circumstances. And I know there was a Dr. Lee Broadhurst at the USDA, and I heard her at a talk one time say, diabetes is not a disease. Huh. It is the natural outcome of the standard American diet. Now, there's more to it than that, and we're discovering some things about, believe it or not, how, because people who are very overweight or even obese, and they're not diabetic.
Right.
Some of this is a genetic component. Some of it, there actually is a lot of research implicating the disturbance of the ecology of our gut, with overgrowth of bad bacteria, creating an inflammatory response that then also contributes to the diabetes.
Mm. All right. Again, if you got any questions about this, you're welcome to join us, 541-776-5368. So you kind of touched on it. Diabetes can or cannot be hereditary.
Well, here's the whole thing about hereditary, and I've talked about this on the show before, and I want to hammer it home. There is not a gene for diabetes. There's not like one gene. We've gotten into this thinking of very simplistic causes. What you inherit is a tendency for almost any of these diseases. Now, not your blood type, and there are certain things that really are a gene carried on a chromosome. They're actually much rarer, those diseases. They get a lot of, it's sexy to talk about them, but they're much more rare. What you inherit is a tendency, and how that tendency gets expressed is diet, stress, environmental toxins, and lifestyle issues. All of these actually determine how your genes are read and how the genes are expressed, is what most of the genetic research is coming out. When they did the Human Genome Project, they thought they were going for the Holy Grail. We're going to find the genetic causes of all these diseases. No, they found out that that's actually not the case, that there's a very small amount of DNA that actually codes for specific things. The rest of it has to do with literally how the code is read and translated.
All right, so before we take a break, give us some beginning symptoms of whether or not you're becoming diabetic.
Well, sometimes it's just, we're catching it early and earlier because people are coming in because you can just be tired. Because the sugar is not getting into your cells. It's in your bloodstream, it's not getting into your cells, so you're not getting energy from it. As the blood sugar goes higher and higher and overwhelms the system, then you get blurry vision. Then you can get, what happens is that sugar spills into your urine and then pools in water. So people find they're urinating all the time, and because of that, they're thirsty all the time because they're trying to keep up with all this water that they're losing, and also maybe hungry again because the sugar's not getting into their cells, so their body is sensing a lack of food. Those are later complications. Obviously, we're discovering people earlier and earlier, and we need to look at people, anybody who's diagnosed with any kind of like heart disease, any of these kind of accelerated aging things. Are now looking at even Alzheimer's or certain dementia as caused by diabetes of the brain, increasing inflammation. So a lot of these chronic diseases should also, we're always looking at blood sugar.
So does it show up in a blood test? Is that
Absolutely. That's the diagnosis at this point, but that's what I wanted to point out at the beginning, is that is an overly simplistic view of what diabetes is. It is not just high blood sugar. High blood sugar is one of the manifestations of the underlying roots that go into this insulin resistance issue, but the diagnosis is by blood test.
Okay, because a lot of people just pooped out, but is it diabetes or something else? Or
all of it together. Yeah, and hormones, as we always talk about, but what's interesting is the diabetes and the insulin resistance will pull down your hormone levels. So they can all be involved in there, but that's certainly one of the things to look at.
All right. If you got any questions, we're going to take a break. When we come back, we'll talk to him more about this. You're saying it's epidemic. I would agree with it.
Well, the CDC says that by 2050, a third of this country will be diabetic. 30% of this country will be diabetic by 2050.
Just because we're eating too much synthetic
because
foods.
We're eating high calorie, no value foods, and we're becoming more sedentary, and even some of these environmental toxins and things like messing up the gut with too many antibiotics and these kind of things that are contributing.
Okay, so a diet soda doesn't necessarily meet the...
No, in fact, there's other problems with diet sodas. So.
All right, Dr. Joel Klein's with us, 776-5368 is the local number, toll-free 800-373-5368. And by the way, if you have a topic that you'd like for him to discuss in the future, email us, theDove at theDove.us. We'll be right back. Okay, we're back with Dr. Joel Klein, and he's the lead physician there at Ventana Wellness, and you're more than welcome to give us a call and be a part of what we're doing here. 800-373-5368 is the toll-free number. If you're outside the immediate Medford area, give us a call. We'd love to hear from you. 800-373-5368, and the local number is 541-776-5368. And again, reminding you, if there's a topic in the future you'd like Dr. Klein to tackle, send us an email, theDove at theDove.us, and we'll get that over to him, and he can put that on a schedule to talk about those items in the future. But today we're taking on diabetes. Huge. It is epidemic. I'm really disturbed to see so many young people getting it. I would assume, again, it's the diet issue.
Yep, 100%.
And you're saying it is reversible. We can get into that a little bit. But it also can kill you.
Oh, of course. But it's a very slow, agonizing death most of the time. Yes, there's much higher risk of heart attacks, strokes, these types of things. But general quality of life, as we were talking about during the break, of people who ultimately, if the circulation breaks down, and wind up needing amputations because the progression of the blood vessel disease that just keeps cutting off circulation. Just general quality of life when the nerves get damaged, then they lose sensation. And all of these different just kind of just progressive worsening of function.
Okay. All right, so the types. What are the
well, it's type 1 and 2, and we're mostly talking about type 2. Type 1 still is the childhood type of diabetes where it may be both an infectious and autoimmune, with an infectious trigger, where they're literally the cells in the pancreas that make insulin are killed off and they have to be on insulin forever. Much harder to deal with. That's an insulin deficiency problem, not an insulin resistance problem. The type 2 is the insulin resistance problem that people who are overweight particularly will have more fat around the waist because that abdominal fat literally contributes to the production of the diabetes, and they then have a vicious cycle on each other. So it's the type 2 that we're mostly concerned about, as epidemic.
All right, so what do we do, Coach?
Well, that's the thing. So the cause, we have to, insulin levels need to be brought down. So insulin levels are already high in type 2 because you've developed this resistance. So you already have high insulin levels, and it is the high insulin levels that are causing a lot of the destructive problems. So we need to get insulin levels down by not eating foods that stimulate insulin. So we're not eating sugar and processed carbohydrates. And I go through the list again: bread, pasta, crackers, chips, cookies, cereal, tortillas, all of these things, especially first thing in the morning. Having cereal for breakfast is probably the worst thing you could possibly do in this case, because that sets your insulin thermostat for the rest of the day into a higher mode because your body is producing it. When you don't, it turns out that your insulin response to lunch has more to do with what you ate for breakfast. So it really is getting breakfast being more protein and healthy fats. And in this case, the healthy fats in the diet are the fats in olives, olive oil, and avocados. Those are literally medicinal for diabetics. So there are people who put people on 4 tablespoons of olive oil a day, somehow worked into their diet to do that. And again, getting rid of the processed foods in particular, and then some form of activity, so if possible. So the best thing to do would be to exercise first thing in the morning. And it turns out it's not how hard you do it, it's how long you do it, which is the worst case because people don't have time. But for like 30 to 45 minutes, working up to it, and then having a low carbohydrate breakfast. We'll keep working the insulin thermostat down then and continue through the rest of the day. And you just have to do that inexorably, and it may take a couple of years sometimes to reverse the issue. Other hormones need to be balanced because, again, your metabolism is going to be hitting only on a few cylinders if your thyroid's out of whack or your other hormones are out of whack. So we have to look at these things as well because that also becomes a vicious cycle. But the main thing is the dietary stuff, and I tell people, people want to negotiate and how much they can get away with. And I say, it says, the problem, this metabolism is as if you're an ocean liner going full head of steam in the wrong direction. There's a lot of inertia behind it. You're not going to turn it around by tweaking the rudder. You got to apply full force to it for an extended period of time to get the thing turned all the way around. Now, once you're turned around, you have that same inertia working for you in a positive direction. You can get away with things better at that point, but usually by that time, people don't even want it anymore. A lot of their cravings have to do with negative cycles that get set up because of the insulin resistance, and they actually do better. And yes, but you can indulge and you can do these things. But in the beginning, it really takes a concerted effort over time.
Wow, this produces a couple of questions. Protein, where does that play in?
Well, protein plays a big role. Now, there's debates. You don't want to overdo protein, but protein does stimulate insulin, but not quite as much as carbohydrates do. But you don't want, we've talked about you need protein, but it's not like you should be just eating big steaks, because that's going to put a stress on the kidneys. I tell people it's like 2/3 of your plate should be vegetables and 1/3 maybe protein, if you're going to do it that way. The most important thing is fat. Fat is the only molecule that doesn't require any insulin for its metabolism. And again, we get into the healthy fats, which is the omega-9 oleic acid that's medicinal for that's in olives, olive oil, and avocados.
Wow. All right, so what role does exercise play? What are you doing with exercise?
With exercise, what happens is you're getting insulin out of the bloodstream into the cells independent of the action of insulin. So you're bypassing where the blockage is. And most of this insulin resistance, a lot of it occurs in muscle tissue. So you're reconditioning the muscle to get glucose independent of insulin and also helping get insulin levels down that way.
Wow. All right. Now, in time, is the diabetic who's taking insulin, are they on some kind of a collision course?
It's a deal with the devil. They may be bringing their blood sugars down, but it's making them worse in most other ways. And again, this is a longer discussion. A lot of the damage from diabetes is from the extra sugar being around, attaching itself to proteins, making them sticky. But a lot of it is not from that. And the problem is you may be helping somebody bring their sugars down, but you're making these underlying inflammation and other problems worse, and you're actually causing them to gain more weight, which is the worst thing you could possibly be doing. And that's what happens when people take actual insulin. So the first thing I want to do is work as hard as we can with the diet and exercise to see if we can get rid of the insulin over time.
All right. Diabetic seizures, they could be quite dramatic, right?
Diabetic seizures?
Well, is that what they are when somebody has a low blood sugar?
Oh, no, hypoglycemic reactions, but that's only in diabetics. That's because they either took too much insulin or they're on too high medication or they didn't eat.
Okay.
But that's, yes. So low blood sugar is actually more dangerous even than high blood sugar, acutely, because you can pass out, you can have a heart attack or whatever. I wouldn't worry about that as much of, that's up to when the doctor treating the patient has to be aware what medications you're using, how we structure the diet to make sure that doesn't happen. But that's more of a medication monitoring and management issue.
Okay. So too much or not enough of one or the other?
It's a balance, right. But if you're over-medicating people or they're not eating, yes, then you're going to drop the sugar low, and that's going to cause a problem too.
All right. In your industry, the medical industry, are we just too quick to call people diabetic?
No. I think that, they've defined it. The thing is, they've defined it as this level of fasting blood sugar 125, but it's a spectrum all the way. People who are now calling them pre-diabetic because they're not really diabetic, but they're not quite normal either. I don't think that we're using the label prematurely. There's a medical definition. We use that here. You fit the definition. Although I just saw a guy in the office even on Thursday. His 3-month test that we call an A1C was clearly in the diabetic range when I first saw him. It was 7.1 or something, and normal is diabetic is 6.5. Normal is 5.5 and below. 3 months of diet work, and that's all I've done with him, and it was 5.7. So he's now went from diabetic to pre-diabetic with no medical treatment. Okay.
Can a damaged pancreas be repaired?
Well, the pancreas issue, again, is more the type 1 diabetes. The cells have been killed off. Usually, like I say, the type 1, they did some studies way back, seeing people when they were newly diagnosed with type 1 diabetes and putting them on these strong immunosuppressive drugs that they give transplant patients and all that. And it worked a little bit, but I've never seen anything after that. But usually if they're killed off, that's kind of it. But again, that's not the issue we're talking about. Now, sometimes adult diabetics, if they come in initially way out of control, and they all even have some insulin deficiency issues as well, sometimes the high blood sugar poisons the cells but doesn't kill them. And you bring the blood sugars down, and all of a sudden things can recover, and they can sometimes come out of it.
Well, big issue. So first thing is to look for the symptoms, which usually are thirsty, lack of energy, urinating a lot.
But that's, again, that's when it's become more advanced along that. So sometimes, yeah, it's just going to be fatigue, visual change, because it changes, the blood sugar issues cause the lens of your eye to change shape. So all of a sudden your vision, will be blurry with that as well.
Wow.
But it's more so, we can actually monitor people way before they have symptoms. So if people are overweight, obviously if they have a family history, these kind of things, we can easily check blood work and catch them way before they become symptomatic.
Do you have, if somebody comes to you and they're in this pre-diabetic stage, or maybe they're diabetic,
right,
do you have a recommended diet plan you give them?
Oh yeah. I have a couple of them, and then we work with them, and we have somebody in the office who coaches people on that as well. Yeah, I'm very specific, and I have menu suggestion plans and what we want to aim for and what we want to do. Yeah, we're going to start with that right off the bat.
So what do you recommend for breakfast if it's not cereal?
Quite frankly, the old eggs and bacon. Sausage is probably not. I don't know, bacon occasionally.
Sugars don't go.
No, sugar-free yogurt. You can put a little bit of fruit in it, but yeah, usually I go with more protein. You can do a little bit of carbohydrate, but predominantly protein and fat. So I know that's always a hard one. Nuts, you don't want to do granola. It has too much sugar in it. So I usually tell them eggs, turkey bacon, these kind of things. Or some people will do, leftovers from dinner. Have dinner for breakfast with protein and vegetables.
Okay, there you go. Well, Dr. Klein, you're interesting. All right. Again, if you want to get a hold of him, ventanawellness.org, .com, right. ventanawellness.com. And you can see all the resources there. And again, if you have a subject in the future you'd like Dr. Klein to tackle, email us, theDove at theDove.us, and we can get that on the docket and get him talking about this. But diabetes, don't take it lightly. If you're dealing with this, take it very seriously. And
treatable, 100% treatable.
I'll have to say this, everybody I know that has had diabetes that took on a lifestyle change came out the other end much better.
Yep, absolutely.
Much better. Now, some got off insulin entirely, some got it greatly reduced, but it was a huge improvement.
Yep.
All right, we'll be right back.